Hello, good afternoon, everybody. My name is John Bañuelos. Welcome to our first school health update of the year, and also the first start of the week of school for some of us. My name is John Bañuelos. Like I said, I'm the school health liaison for rural and tribal. We have a very exciting meeting today. I would like to just go over the agenda first. So we have the agenda set up here. So we're going to start with our announcements that we usually do. Then we'll have our EPI update. Then we have Kavina, our team, Kavina Kamkate is going to be talking about Why Hat, Not My Kid, and Not Alone. The community mental health and addiction team, we got Heather Severson is going to be speaking on her program. And then we also have Arizona Heat Safety presented by Betsy Kamana and Nate Young. Again, after all the presentations, I'm just going to keep going through the health update. And at the end of the presentation of our health update, you can ask questions here in the chat and we'll answer those for you. Next are our announcements. We don't have too many, but we do have our school health newsletter that you can click on here. If you haven't signed up, please sign up there, and there's the link to sign up for that. That will be coming out pretty much at the middle of the month, and that will also have another health information as well as a recording of this school health update that we're going to present today. All right, so we are going to go next right here with our respiratory update. COVID-19, RSV, and influenza. That's going to be with Jacob Alexander. Jacob, are you on the call?
Good afternoon, everybody. My name is Jake Alexander. I am one of the epidemiologists in our epidemiology division, and I will be presenting on our respiratory update as well as some school reporting updates. Go to the next slide, please. So currently we're in week 30 of the 24 to 25 respiratory season. In our current respiratory season, we've had about 1,400 confirmed cases of RSV, which is higher than normal. Last week we did have 0. Again, we're not in respiratory season right now, but as we get more into the fall months, we expect to see those case counts start to increase a bit. Next slide, please. Speaking of respiratory season. Here we have our influenza seasonal report. In our current flu season, we've had about 7,400 confirmed cases, and that is also quite a number, or quite more than normal. This is 145% more. Again, as you can see, we're sort of at the summer lull portion of our flu season. I say season. We're not really in respiratory season yet. That won't start until the end of September. But again, as we start to get into the fall months, we expect to see those counts start to increase as well. And especially for schools, that's something to keep an eye out for. Making sure that students are sent home and not staying in school while they're sick will help to prevent spread. Next slide, please. And then finally, we have our COVID-19 seasonal report. So for anybody who is new to the call, I'll kind of explain why this figure looks the way that it does. In previous years, our COVID counts were so high that if we were to keep the scaling as is, with 1,000, 2,000, 3,000, 4,500, or 5,000 cases, and so on and so forth, the yellow bars, which would allow us to see the differences in case counts for the current year, would be too small to really tell the difference between. So that's why the case counts from 2,000 to 5,000 are truncated. If you could imagine, this figure would actually be 5 times the size as it normally would be. But what is good is that compared to previous years and our 4-season average, our COVID cases are down on the year. We've only had about 9,400 confirmed cases, and that's 85% less than usual. Same thing with the other respiratory viruses. As we start to get into the fall and winter months, we do expect to see those case counts start to increase. Next slide, please. And then here we just have our case counts by MMWR week overlaid on top of each other so that you can see them all. As you can see, again, case counts are relatively low, and because we're in the summer months, they stay pretty consistently low. Next slide, please. And then this should be the last slide. I think that didn't. Oh, okay. I think I could have made that a little bit bigger to be able to be seen a bit better. But this is the 2025 updated reportable communicable diseases for schools, childcare establishments, and shelters. The main changes is the addition of quote unquote emerging or exotic diseases. So that is now a 24-hour reportable that is basically anything that doesn't fall under those defined parameters. We do want to say that if there are any cases or outbreaks of any communicable disease going on that may not necessarily be on this list, the epidemiology division is still willing and able to provide resources and support for any school that reaches out to us and inquires. If you click the link, I think the slides will be sent out afterwards. Yeah, thanks, John. But so if you click the link at the bottom, it'll bring you to the ADHS communicable disease reporting site for schools and childcare, and they have some more information on what is reportable and the timeframes with which they need to be reported. And that should be my last slide. Oh, perfect. Thank you, Chris. Does anyone have, oh no, we're waiting till the end for questions. All right, thank you very much.
Thank you so much, Jake, for that information. And then again, we have here in the chat, the links on the slides here are clickable for everybody who's actually viewing the slides today. So we're going to go to our next presenter. We have Kavina Kamkanti, who is our Youth Population Senior Health Educator.
All right, good afternoon, everyone. My name is Kavina Kamkanti. I'm with the Youth in Schools program as the Youth Population Senior Health Educator. I've mainly focused on youth mental health and substance use prevention, alongside with our You're Not Alone initiative services, the Youth Health Action Team, and our collaboration with Not My Kids Project Rewind. You can go to the next slide, John. So starting with You're Not Alone, we have all these youth mental health services. The number one thing is our therapy service. We can offer up to 5 free therapy sessions for ages 24 and under through La Frontera. No need for health insurance. We offer in multiple languages. It's free of cost, of course. Then we have our suicide prevention partnership with Teen Lifeline, which helps to prevent teen suicide in Arizona by building youth resilience in supportive communities. They have a lot of peer-to-peer services that help throughout Arizona. Then we have our Be There certificate. It's a free self-paced certification training that takes an hour and a half max. And this is in partnership with the libraries. We work with 13 libraries. And when a youth completes the certificate, they go to one of those libraries and they get a $40 gift card as an incentive for completing the certificate. Our team has also been doing workshops within the schools and partnering with specific teachers and counselors and doing these workshops with the students, bringing the gift cards with us. So it's kind of like a one-stop situation, helping out with youth who don't have transportation to the libraries or just they're just not capable of getting the gift cards. So that's another thing we have. And then we also have a form to support schools and parents. This is a form to schedule any mental health workshops or have any questions. It goes to our program. And then you can go next, John. And the next is our Youth Health Action Team. So we are now accepting applicants until August 15th. This is a youth-led coalition between the ages of 14 and 24 who work together to focus and advocate on youth mental health or behavioral health or substance use. And they just create a ton of projects, a ton of advocacy tools, and it's completely youth-led. So our team kind of just supports them alongside with some of the librarians that we work with. The meetings happen twice a month from September to April. And this also has leadership opportunities such as the Youth Executive Board, which consists of presidents, the president, the vice president, and secretary. And they're also able to attend any events. Like our last cohort, we had 22 youth and they attended the summit. They were on the youth panel. So it's a very good opportunity for networking, connecting with friends, and just advocating for youth mental health. So yeah, so there's that link right there if you know anyone interested who would want to be a part of YHAT. And then next slide. And then we have our Not My Kid Project Rewind. So Not My Kid is actually based in Maricopa. They have a ton of programs that focus on substance use. And so Not My Kid reached out to us wanting to expand to Pima County and specifically their Project Rewind. So this one focuses on first offender students who are caught with drugs at school, and instead of doing suspension, they would do this early intervention program with a guardian. And it works closely with the schools. And yeah, so it focuses on strengthening family communication and connection. It helps teens understand the reasons behind substance use and its real consequences. They do, like on the flyer there's an online education session, a live group session where they do some role play, and an individual session if that is necessary. And yeah, and then we have the link to the family registration. Staff can register for the students, or families, if there are parents out there who are concerned about their child, they can also register for their child as well. Next slide, please. And yeah, so that's my contact information if you guys ever have questions, which can be saved for the end. Thank you.
Thank you so much, Kavina. And it was some great information that we had there for the kids in school. So we're going to go next to our next presenter here. And we have our Community Mental Health and Addiction Division. Heather, are you on the call?
I sure am. Thank you so much for having me today. And I'm going to follow on with a little bit of more mental health information. So here's my contact information, and I'll provide this later. And you'll, if something I say resonates and you're like, oh, I need to talk to Heather, we'll make sure you can get that. Next slide, please. Okay, so this is sort of where we're coming from. I'm not going to read all this out, but just provide to you what the division is really aiming for. And one thing in particular that we want to support is making sure that youth in our communities have access to the resources they need. Each one of you in this meeting is a protective factor to help folks address adverse childhood experiences. And we'll talk about that training in a minute. We have a vision where stigma is eliminated about mental health conditions, so that people who need care for mental health challenges to get the same kind of approach and matter-of-fact treatment as you would for any kind of physical ailment. That we believe that will reduce barriers to care and help people have a higher quality of life, which will improve spaces for our youth as they grow and our community. And our team purpose is really to connect public health professionals, resource providers, and all the people, you all and everybody else, to the resources they need. Next slide, please. And recently we went through a little bit of a strategic planning process. And so we really spent a lot of time figuring out exactly what the values are and the cultural enablers or the tools we're using in order to use this work. So anytime you encounter any of us out in the field, we hope that these are the kinds of experiences that you take away with your work for us. We really want to bring authenticity and love and compassion and empathy to our work. Next slide. Okay, so we really do believe that the youth are the future, and we really want to do as much as we can to support their development and safety and well-being in the world. And so some of our trainings can be or are dedicated to youth, and many are dedicated to youth-serving professionals and just members of the community. And to that end, we have a brand new course that we're adding this grant cycle, Understanding Adverse Childhood Experiences, or you may know them as ACEs, and the impacts of childhood trauma. So we can provide this as an overview of adverse childhood experiences and the really great research that folks have been doing about this, about how it affects the brains and bodies of behaviors of children and what the consequences can be even into adulthood. So this course, we can make it a little bit modular, or we can, if you talk to me, we can make sure that we get it to you in the length of time and the format and the context that you need. So generally it's a 2-hour workshop, but if you only have 20 minutes in front of a faculty or staff meeting and you want to at least sort of address some of these topics, reach out. We can bring some of this information to you in small pieces. Next slide, please. This class is an 8-hour course, and it is Youth Mental Health First Aid for Tribal Communities and Indigenous Peoples. This course equips individuals with skills to recognize and respond to mental health challenges for youth and substance abuse issues, particularly with sensitivity to youth in our tribal communities. Arizona has at least 22 recognized, federally recognized tribal communities in our state, and we want to bring respect and consideration to those individuals, because their context and their beliefs and their needs and their resources may be different than that come out in some of the typical trainings that we offer. So we can do this 8 hours in 1 or 2 sessions. We can do them on evenings and weekends if that helps. It is a certified training for that, and it is limited to 35 participants. Next slide, please. Okay, we do quite a bit of overdose response and harm reduction training. We teach community members, including youth, how to recognize signs of an opioid overdose and respond by administering Narcan nasal spray. This discusses some of the current trends in our community, shares tips with people who use opioids for pain management, for diseases, or use illicit drugs in order to reduce their risk of an exposure or an overdose. And one of the things we are really focusing in right now is helping people who do have chronic pain conditions to manage their pain. And so I'll tell you a little bit more about that training. But this is important just as a community to be aware of this, that the numbers for drug overdoses are really high right now in our community. Narcan kits can be distributed to this training, but I also want to note that anybody in Pima County can go to your local library and get Narcan for free. Now, if you want to order some more for your organization or your school or your location or some community organization that is separate from your job, you can reach out to me and I can introduce you to our Narcan request form so that you can come and get some more in more volume if you need it. We have a longer version, but we can also make it shorter, kind of depending on your time needs. I know that educators in particular have very, very tight time in order to do some of these trainings. So you can reach out to us and we can make sure that we customize this to your needs. There's the link there. I don't know if it's a live link, but again, if you reach out to me or we can hook you up with that. Next slide, please. Okay, so this is the chronic pain management program that I was talking about. And this may have a little bit less relevance for educators, but you may encounter in your work students of any age who may be dealing with post-injury chronic pain or illness. Their families may be struggling with this. So this is a 6-week workshop. It was developed by Stanford University. It's very evidence-based and really talks about ways that people can manage their pain in conjunction with opioid use, or even perhaps to replace and have them be able to stop using opioids. I am a lived experience person who's gone through chronic pain and took opioids, and I no longer do. So I very much can testify to the strength and efficacy of these things we can teach in here. So again, if you or somebody in your community needs this, we can set you up for that. And we can do this again, weekends and update on evenings if that works better for community access. Next slide, please. Okay, I want to make sure that we acknowledge our funding from the Trauma-Informed Substance Abuse Prevention Program and Overdose Data to Action. Those are our current funders, and we're really grateful to them in these times to help us bring this at no cost to anybody in Pima County. Next slide. Okay, so this is not a grant-funded program at this time. We're going to add it for our next grant cycle, but we're still going to offer it. Particularly, we can tie it in with the advancing or the adverse childhood experiences training. This is a 5 skills based resiliency training that helps folks, particularly youth serving folks or first responders, to work on self-care so they can do the work to support the youth. Again, this is modular. If you wanted, we could bring a 20-minute pre or post faculty meeting module to you, or do an entire up to 5 hours. This audience can be for youth or adults. There's no participant maximum or certification for this one. Next slide. Okay, so right now we are working to retain or regain funding for QPR gatekeeper training for suicide prevention and our strengthening families program. So if you or anybody in your community has done this in the past, we are on hiatus until we can find some funding for this, but please do reach out for us if you're coming to the end of your 2-year certification for this, and we will either connect you with a community partner who can offer this training or let you know the status when we are able to bring this again. And these again are youth serving, and a youth can also take the youth QPR course. And the Strengthening Families program involves youth with their families. This is a multi-week program. We can do it virtually so that makes more access for anybody with school-age children. And there's some incentives for participation. So if you have questions about that, we can provide that information to you. Next slide. Okay, so this is our crisis response resource page. We are in the process of updating it right now. If possible, I'll get this to John and we'll send this to you digitally. It's in English and Spanish, and we just went through and verified all the hours and the contact numbers and added a couple new resources that we just learned about. So these are still very valid for your community. So we'll make sure that you get this as well. Next slide. Okay, again, we've got a link to our website for our division, for the Community Mental Health and Addiction Division, for trainings and presentations. And you may see some training topics that are listed there that we're not, again, we're on hiatus, but we have faith that we're going to be able to bring them in the future. So we went ahead and left them up there because it's just kind of difficult to update our website, especially when we believe we'll be able to resume our training for that. And again, there's my training coordinator information for you, and we'd be happy to put you on a training schedule, and I will stand by for questions when it's time. And I believe that's the end of my presentation.
Thank you so much, Heather, for the wonderful presentation. Again, there's a lot of information on all these slides, and they are clickable, so you can definitely go on the slides right now and click and get the information that you need. I also did put information there on the chat here. Everybody on the call, if you can please put your name and the school that you're representing or agency that you're representing, that must help us with our tracking purposes there. So we have our next presenter, our final presenter for today. We have the Arizona Heat Safety, and we have Betsy Camara and Nate Young going to be presenting.
Yes, thank you, everyone. Can you hear me okay? John, are we good? Awesome.
Yes, we're good.
Yeah, and thank you so much for helping put your information in the chat. We're just trying to track how many schools we do outreach to, and those that we're missing, we're going to circle back with them. So thank you for that. And like I said, I'm from Pima County Health Department with the Office of Heat Response and Relief. We can go to the next slide. So just to give a little overview, we all know it's hot in Arizona, but heat is considered the #1 weather-related cause of death nationwide. So it's a huge issue nationwide, but especially in Arizona. And we do see trends that temperatures are continuing to rise each summer, resulting in extreme heat and extreme heat-related deaths. So what is considered extreme heat? Like, we know it's hot, but what is extreme heat? So this is a series of days that are hotter than average for a certain area. So again, we know it's hot in Arizona, but it is getting hotter and hotter. Today was expected to be actually a record-breaking heat, hitting about 112 degrees, which is the hottest it's ever been in Tucson. And so it is extremely dangerous, and it can affect a lot of people. And it doesn't discriminate. Heat affects everyone. We do see that some populations are a little bit more vulnerable. So infants and children, people 65 and older, pregnant women, people with chronic conditions, or people taking certain medications, unhoused populations, outdoor workers. It really does just affect everyone. And we do now see that long-term effects are just as bad as smoking. We are seeing that there are some correlations and can be worse than people who smoke long-term in their life. So it is becoming a bigger issue every single year. We'll go to the next slide. So specifically in Pima County, in last year alone, we had 112 days over 100 degrees. And over the summer, it's pretty common for us to hit 100 degrees every single day. So we consider heat season to be May through September, but we are expanding those days. Last year alone, we had in Pima County, we had 787 heat-related hospital visits just during this time and 101 heat-related deaths. But we are seeing earlier, so April, even end of March, we already hit a couple 100-degree days in March this year in 2025. But we are expanding our heat season so that we can keep better track and keep people safe. And like I had mentioned, we are seeing record-breaking temperatures yesterday or today and tomorrow. And in 2023, we had 34 heat-related deaths among 15 to 24-year-olds. So really looking at the populations that you all work with at the schools. So really understanding that this is still a major issue among a lot of our target populations. Next slide. So like I'd mentioned, heat season in Arizona kicks off in about April and it goes through October, mid-October. But we are continuing to advise on this, continuing to talk about it, continuing to promote cooling centers and other heat relief services until it stops being hot. So we might be going into November soon enough because it's getting hotter later in the year. I just wanted to give just a brief little update. So if you are connected to the National Weather Service, they issue heat warnings and heat watches. And so I just wanted to educate a little bit on the difference between this. So a heat watch is that dangerous heat is possible, but we don't know for sure. We have all the actions, we have all the things ready to make it possible, but it hasn't hit yet. And then once we hit the heat warning stage, that's when we really need to take action because the heat is here and it's happening. So doing mitigation, doing prevention strategies, really making sure that we're keeping people safe. And there's just some definitions on how NWS does issue those heat warnings. But just to let you all know that once we hit that heat warning stage, it's kind of too late. So we need to prepare. We need to make sure that we're keeping kids safe and keeping other populations safe. Next slide. So like I mentioned, NWS will issue a heat warning letting us know that we are in danger zone and that we should take mitigation efforts. We should prepare ourselves. So this is kind of what they develop and what that looks like. This is something that you can get notifications on. You can get them sent to your phone. A lot of us have like weather updates on our cell phones that send us information about it. But this is actually issued, well, it was actually issued on August 3rd for today and tomorrow. So yeah, prepare yourselves. Next slide. And again, NWS actually just issued a heat risk this week, which means that we are in a heat warning, but there's also extreme risk that a lot of people are now vulnerable. And then we have a chance for temperatures over 110 degrees. So today was supposed to be our highest day at 112 degrees. I'm not sure if we hit that yet, but we're about to hit the hottest part of the day. And so understanding that during these times, we need to take extra precautions to keep ourselves safe. Next slide. And then just the difference between a major heat risk and an extreme heat risk. So basically major is that much of the population might be vulnerable and that these are just certain actions you can take over on the right red side of the screen on the right. And then if you look at the purple, extreme risk means that the entire population is at risk. So again, actions that you can take, but please consider canceling outdoor activities, staying inside, checking on your neighbors, drinking lots of water. Even if you are inside, you are still at risk for heat-related illness and really keeping yourself cool. Next slide. So how can you check your heat risk? So the CDC has a really cool heat risk tracker where you can, and I added this little QR code on the bottom that you can scan, but you can also just type in your web browser, cdc.gov/heat risk, and it pops up this page and it sorts it by location. So I put in a Pima County zip code. you can see the heat risk, and then it takes you through steps and precautions that you can take to keep yourself safe, as well as the forecast. So again, this is really important if we are working with kids, if we're doing outdoor activities like recess or even like sports and taking walks, or kids walking to and from school. It's kind of the hottest part of the day when they're walking home. So how can we keep those kids safe and understanding their risk? And seeing if we can do ride shares or ride pickups or helping those kids get home safe, or taking breaks or taking the shady routes on their way home. But it's a good way to educate school members, educate kids. They can look this up on their own, educate family members, making sure that we can keep people safe during this time. Next slide. Another mitigation strategy is teaching people how they can check to see if they're hydrated enough. So drinking water regularly and consistently before, during, and after physical activity is super important. I guess the CDC and other healthcare organizations used to recommend a certain minimum of ounces or glasses to drink a day. And now we're going towards actually just check your body, check what your body needs by looking at your pee, looking at your urine color. And so we've come up with this kind of clever little sticker that if it's this light yellow, not white, we don't want it to be clear, but if it's this light yellow, you're good, you're in the clear. And if as you get into the darker yellows and browns, that's when we're hitting the danger zone. So you need to drink more water. So really understanding that people need to, or should, understand their bodies and how much they need to drink, and teaching kids early. And if you are in those danger zones, there are some things you can do. You can drink sports drinks, eating some salty snacks alongside of water, or using electrolyte packets like Liquid IV or even Gatorade to replenish some of those electrolytes. Next slide. If you are going to be outdoors, there's some mitigation strategies, some protection strategies you can use. So wearing loose, lightweight, light colored clothing, natural fabrics, cotton or linen. Those types of fabrics can keep you cooler, especially if you are outside in the heat. And then using sunscreen and sun protection, wearing hats, umbrellas, sunglasses. So again, just trying to keep yourself safe if you do happen to be outside. Next slide. And then if you are experiencing heat cramps or heat exhaustion, so signs of heat-related illness, there are some basic first aid that we can teach people to do, or that you can help, like coaches or teachers, or you all can help mitigate with kids as well. So heat cramps, so that's sometimes called like a Charlie horse, or yeah, your leg cramps up and it just hurts. You should stop activity, rest, sip water and electrolytes, lightly stretch or gently massage the area that's cramping. Once the cramp stops, and if there's no other symptoms being experienced, the individual can go back to their activity, but continue to monitor for additional signs of heat-related illness. And then if it's heat exhaustion, so signs and symptoms could be feeling faint or dizzy, rapid weak pulse, excessive sweating, the body feels cool, pale, or clammy to the touch. You should move this person to the shade or into an air-conditioned space. Lay the person down, raise the legs and feet slightly so that they can get blood and get their heart rate down. You should remove tight or heavy clothing, anything excess that doesn't need to be kept on the body. Sip chilled water with electrolytes, and you can even spray with cool water or place a wet towel or ice in some hot spots. So like in the groin, on your neck, on top of your head, there's some spaces that a lot of body heat releases, so you can cool those down pretty fast. Next slide. And then if someone is in heat stroke, you should call 911 right away. So signs and symptoms of heat stroke are loss of consciousness, really confused or don't know where they are, rapid or a strong pulse, body temperature is really hot or dry, and this person stops sweating. So as soon as the major sign is the stop sweating, their body isn't able to accommodate for the additional heat stress. And so their body's not doing what it's supposed to be doing to cool itself down. So again, you should call 911 right away. if the person is unable to take fluids or confused, unresponsive, or experiencing any of these signs, that's when you should call 911 right away. And then what should you do once you call 911? Do not give any more fluids because it might lead them, especially if they're unconscious, it might lead them to choke or choke on their own vomit or not be able to recover. You should put them in the recovery position in case they are vomiting. Keep them lying down and then monitor for signs of stroke or trouble breathing. But stay with them. Do not leave them. Ask someone to bring an adult or bring someone else to help as well. Next slide. And then these are just some things that you can have on hand to prepare for these heat emergencies. So having water bottles on hand, cool water bottles or cold, even iced water bottles that have been kept in the freezer, so you can cool someone down quickly and or give them to drink. Having electrolyte packets or electrolyte drinks, so sports drinks available. Squirt bottles that you can spray down an individual to help with evaporative cooling. Ice packs or cool packs. Disposable or cooling towels, anything that you can get wet and place on a person's body to help them cool down. Fans, and shade structures. Special note that fans and spraying water only work if the heat index is lower than the body temperature. So really understanding a person's, can't evaporate that, the wind won't cool them down if it's hotter outside than their body temperature is. And so really knowing that like air conditioned spaces are really the best option if someone is in a heat emergency. So having access to a building or a car or something to cool that individual down is super important. Next slide. And then just a special note that we are learning more and more about medication and heat interactions. And so really understanding or educating kids, adults, parents on if someone is on medication, what that might do and how heat does affect it. So it might affect the way the medication interacts with their body. So it might not be as effective. It might reduce the ability to protect that individual or provide the preventative medicine with it. Or it might make them more vulnerable to heat and heat exhaustion. So really understanding there's a lot of good resources out there. ADHS and our team has put out a lot of good informational and educational materials out there. So just understanding what that looks like and having people ask their doctor, their providers, their pediatrician on what that might look like and how they can keep themselves safe during heat events. Next slide. And then some other helpful tips. So like I mentioned, the National Weather Service comes out with a lot of weather alerts, lets you know when there's a heat watch, heat warning, extreme heat event, and gives you lots of tips on how to keep yourselves safe. If you are, inside, you can cover your windows in the house to prevent the sun from getting in. So really keep your house cooler, which can also help with your electricity bill. Limiting use of the oven, so eating cooler foods. Not cooking for long periods of the day will help in extreme heat events. Also eating small meals throughout the day will help your digestive system and help you stay cooler throughout the day instead of large meals that your body heats up faster. Don't rely only on fans, so really take advantage if you are able to use air conditioning or swamp coolers, evaporative cooling, really making sure that you're not relying on fans only, especially in Arizona heat. And then there are home weatherization programs, air conditioning repair, utility assistance that are available in Pima County. So we have on our website, the Beat the Heat webpage, the QR code will take you there, or you can go to pima.gov/heat. Has a lot of resources available to people if you are interested or referring families to these resources. And then we do have an electric moratorium that was passed, I think in 2023. But electric companies, so that includes TEP and APS, if you're out near the Ajo area, they will not shut off anyone's electric system from June 1st to October 15th. But they will, so they'll put a pause on billing. If you are behind on billing, you will have to pay that bill at the end of the season, but they won't shut off any assistance so that you can stay safe during this period of time. And so people won't have, heat-related illness in their own homes. So I think that's it. You might just have, questions. Please feel free to contact us. Nate had to go on to another call today. But like I mentioned, my name is Betsy. Please reach out if you have any questions or concerns. We are trying to get connected to the schools. So if you all want us to come out and do a heat-related illness education session or work with teachers or other school providers, we are here and available and happy to help provide these resources for you all. So thank you so much for your time.
Thank you so much, Betsy, for that wonderful presentation and all the presenters today. Again, I will keep the information up here, and I want to thank everybody for joining us today and putting your information in the chat. That was very helpful for us also, like Betsy said, to help tracking. Wanted to also let everybody here on the call know if there's any other folks that you think that would like to participate in the school health update, please forward over the invite, or they could also email us here at our school support at pima.gov email. You could also visit us at pima.gov /healthy schools, or give us a phone call, 520-724-7018. We'd love to speak with you. And again, we have programs on here that would also answer any questions. If anybody has any questions right now, please put it in the chat and I could get those questions over to them. All right, so it doesn't seem like anybody is putting any questions in here. I will stay on here for a couple minutes there, but I do understand today is probably an early day for everybody. I know they want to probably get out after the school. Want to thank everybody for joining us for our first school health update. We will have our next school health update in September, the first Wednesday of the month. And again, thank you for joining us. Please reach out if you need anything from the Pima County Health Department. And again, have a very wonderful day. I don't think there's any more questions, so I will be ending this meeting. Have a wonderful day, everybody. Thanks again for all your help. See ya.